Barrett's esophagus is a pathological condition in which patients suffering from gastroesophageal reflux disease, the esophagus in them face recurrent and continuous assault of stomach acid in the lower part of esophagus. And as a result of that acid insult leads to a chronic inflammation. And this chronic inflammation finally leads to something known as metaplasia. Metaplasia means replacement of one type of cell by another type of cell. As in, you can see over here, that is, the normal cells of lower part of esophagus are stratified squamous epithelium, this part, but due to this chronic inflammation, this stratified squamous epithelium has got converted into simple columnar epithelium with certain glandular components. As you can see over here, there are glandular components which have goblet cells in them and secrete mucin to neutralize the stomach acid. This change is done to tackle the acid insult by producing mucin, which can neutralize the acid to some extent, and this is known as metaplasia. Now, the clinical features of Barrett esophagus is GERD-like, because Barrett esophagus as such is not a clinical condition, rather it is a pathological condition. So GERD-like clinical feature means they will have heartburn, retrosternal pain, etc. Now, the diagnosis of this condition is by means of esophageal endoscopy, in which an endoscope, that means a camera containing device, is passed down the alimentary canal of the patient into the esophagus, and we view the esophagus through that camera. Now, this image shows a normal esophagus, but over here the image below shows a clear demarcation between the normal epithelium and the metaplastic epithelium. This particular image is very, very important from USMLE or NEET PG point of view. Now, this Barrett's esophagus has multiple complications. By definition, it is a metaplasia. Long-standing metaplasias can lead to something known as a dysplasia, and dysplasia can lead to cancer, and hence the complication of Barrett's esophagus is esophageal cancer. So the treatment of this disease is basically, once cancer develops, the treatment is very simple. The treatment is a mix of chemotherapy, radiotherapy, that is radiation, and surgery. But as such, Barrett's esophagus does not need any treatment. It is observation and treatment of GERD and management of GERD.